Breastfeeding. Breast milk is specially adapted to meet the needs of the baby from birth. It, therefore, has benefits for its health and development. In addition, breastfeeding also has benefits for the mother. What does breast milk contain? The composition of breast milk varies during breastfeeding to adapt to the needs of the baby. It can also change depending on the mother's diet. This can change the taste of the milk, allowing the baby to get used to different flavors. Breast milk contains more than 200 components. It is composed proteins that are non-allergenic, easy to absorb, and easy to digest. Sugars and fats that provide the energy needed by the baby's cells. Vitamins and minerals like vitamin C and iron. Enzymes that help the baby's digestion. Essential fatty acids that may influence brain and vision development. Antibodies and antimicrobial molecules that help the baby defend against bacteria and viruses. Hormones and growth factors that may stimulate the growth and development of the child's digestive system and immune system. Living cells that protect the baby from infection and stimulate its own immune system. What are the benefits of breastfeeding for the baby? There is plenty of scientific evidence on the benefits of breastfeeding. Breastfed babies are less often affected by infections. Their risk of gastrointestinal infections, for example gastroenteritis and diarrhea, is significantly reduced compared to babies fed commercial formula. Breastfed babies also have a lower risk of upper respiratory tract infections, colds, flu. Breastfeeding also decreases the frequency of bronchiolitis, pneumonia, and ear infections. Breastfeeding is associated with a reduced risk of sudden infant death syndrome. Breastfeeding could have a protective effect against certain inflammatory diseases, for example, eczema, type 1 diabetes, inflammatory bowel diseases such as Crohn's disease. For asthma, food allergies, and hay fever, the protective effect is less clear. Some studies suggest that breastfeeding reduces the risk of overweight and obesity. However, the results of the studies are sometimes contradictory. The majority of studies have noted that breastfed children perform better on intelligence tests. This is an acceleration of cognitive development, and the beneficial effect seems to diminish over time. What are the benefits of breastfeeding for the mother? Exclusive and prolonged breastfeeding can help the mother lose weight gained during pregnancy. Breastfeeding reduces the risk of breast and, possibly, ovarian cancer. Exclusive and prolonged breastfeeding delays the return of menstruation. How long should breastfeeding last? The World Health Organization and UNICEF recommend feeding babies exclusively breast milk for the first 6 months of life. Breastfeeding can then continue for 2 years and beyond if complementary foods are also included in the baby's diet. Some beneficial effects of breastfeeding on the health of the child and the mother are related to its duration and its exclusivity. The longer the breastfeeding lasts, in a number of months, and the more exclusive it is, breastfed child only, the greater certain beneficial effects are. For example, children who have been exclusively breastfed for 4 months are more at risk of infections between the ages of 4 and 6 months than children who have been exclusively breastfed for more than 6 months. To remember, breastfeeding has benefits for the health and development of the baby, but also for the mother. Breast milk contains more than 200 components. Its composition adapts to the needs of the baby. According to official recommendations, babies should be fed exclusively with breast milk until the age of 6 months.